This means extending the vaccines to anyone that lives within the same household. Local 22's Dana Casulo has more.
The health department has partnered with UVM Medical School and local organizations to break down linguistics and cultural barriers for new American families interested in the COVID-19 vaccine. The Vermont Health Department set up pop-up clinics with the UVM Medical Center to vaccinate refugees and immigrants who are 75 and older. Members in their immediate household are also eligible.
Many household members who live with elders in refugee and immigrant communities are generally their caregivers, so it made sense to extend it to household members.
To address concerns, educational sessions have occurred.
We have held vaccine education outreach sessions to answer any questions that communities might have or concerns related to accessing the vaccine.
Vermont's Deputy Commissioner of Public Health says, "It's vital we gain the trust within communities who may be skeptical of vaccine safety."
This is really grounded in the public health data that tells us that these more vulnerable communities in Vermont are 3 or 4 times more likely to be infected with COVID, more likely to be hospitalized, and nationally more likely to die from COVID.
The health department is working with the Association of Africans Living in Vermont for further outreach about how this virus affects certain populations.
Higher rates of chronic disease. So we know in Vermont that people of color generally have higher rates of chronic illness. So if they become infected with COVID, they may be more likely to become ill or hospitalized.
Dolan says this is protecting all of us.
Anything we do for anyone who is at risk in Vermont really ends up protecting all of us.
If you're interested in learning more about the educational sessions, we'll have a link on our website at mychamplainvalley.com. Reporting in Burlington, Dana Casulo, Local 22 News.